welcome everybody. And it's been such an interesting year already for 2021. And so it's going to be kind of interesting to see how the rest of the year goes, especially after last year when we had so many things going on. And what brings to mind our emergency preparedness, especially when we had the institution of the national emergency with the public health emergency, also known as COVID-19. And a lot of facilities ended up activating their emergency preparedness plan. And some of them were a little surprised when they realized how much they really had to do in order to comply with CMS. I've also included email addresses for CMS, and they are very good at getting back to you. In fact, I reached out to them yesterday afternoon late, and this morning, bright and early, when I turned on my computer, I already had a response. And in fact, that response is going to deal with one of the items we're covering today, and that happens to do with your after-event reporting. We're talking three things today in particular. I'm going quite in depth through key definitions because that's crucial in this regulation. CMS made some changes very late last year to this regulation, and those definitions really carry a lot of weight in it. We're going to talk three key essentials in the emergency preparedness, and we're going to show how the four core elements of a program really make the program necessary, essential, and to complete those, that's why you have to be so prepared. So completing those core elements, you're going to be ready. There's the Appendix Z. That is where CMS has combined each and every type of facility over which they have oversight, where they put all of the information for an emergency preparedness plan. It was updated early last year, and there have been some changes since then. Some have to do with COVID-19, granted, but they did make some updates to the emergency preparedness plan. A lot of it does affect hospitals, by the way. That's critical and acute care hospitals. It also involves the life safety code. We're talking on that because it talks about in the plan how you have to integrate requirements under the life safety code. So if you happen to be a member of a hospital that is involved in plant operations, you're the emergency management coordinator, or you're involved in the environment of care, that's going to be very key to you. And in fact, some of you may already know some of these key definitions and some of the requirements. So I want to start off with a video. This one does not have any sound to it. It is quiet, and I got it off YouTube, as you can see. And this is from the St. John's Hospital in Joplin, Missouri, when they were hit with a tornado back in 2011. And like I said, there is no sound to this. What happened, St. John's knew that they were having some bad weather. It wasn't going well for them. And so they preemptively decided to evacuate the critical parts of the hospital, and especially the emergency room. They were able to get people out of here. That's why you don't see anybody in there. But what is so telling when you watch this video is the sheer magnitude of wind and how it can just destroy something so fast and so much. And so while you watch it, you see at the beginning things are kind of calm and not too bad, but then things start to move around. And again, you will also see just how much force that wind can exert, not only on just the chairs and the magazine that's floating around in this video, but you'll also see the aftermath of it. A lot of what you're seeing right now is simple debris that came off the ceiling, off parts of the wall. Other rooms had items pulled out of it. And so it was really, as I said, very devastating tornado. And that was such a bird's eye view. It's very unique to see it from within the hospital. So moving on, this is the exterior. That's what happened after the fact. As you can see, it was demolished. That is the hospital in that upper left-hand corner picture, and some of the surrounding buildings nearby. You can see windows are shattered, windows are torn out, and there's the helicopter. It was literally picked up, tossed, and landed down again. That is how bad that tornado was, and it hit hard and it hit fast. They were fortunate just for that one little clip to see what didn't happen. All right, I mentioned we were going to go through definitions extensively. Like I said, it's very key to have an appropriate emergency preparedness plan. So an emergency disaster. And this is how CMS describes them, by the way. And these came from the Assistant Secretary in Emergency Preparedness. Emergency is an event that can affect your facility internally and the overall population. That's your target population. It can hit the community at large, or even a geographic area. That can be like a hurricane when it hits New York, the Sandy area. And then you also have Florida. Florida, Texas, Houston, those areas are very familiar with how devastating those hurricanes can be to an entire geographic area. It's also a hazard impact, causing not only physical, but social, psychological, economic, and political effects. And it can challenge the ability to respond rapidly and effectively. So an emergency is, this is what's going on right now at this moment. It requires stepped up capacity and capability, not only of hospitals, but of providers too. It requires that we have callback procedures and mutual aid systems in place. The idea is we want to meet that expected outcome. Now that expected outcome may be entirely different than what we're used to on a day-to-day operation, where our expected outcome is find out who's damaged, who's injured, how can we assess them, how can we take care of them. And it usually requires a change from our routine management day-to-day operations to an incident command process in order to achieve that outcome that we're hoping to make. A disaster, also a hazard impact, same thing, causing adverse psychological, social, and political effects. And this one challenges our ability to respond rapidly and effectively. And even though, despite a stepped up capacity or capability, such as callbacks, so we were ready for it, we're ready for this disaster to occur, we still have to change how we operate on a day-to-day basis. So we have to change from our routine management to that incident command. Unfortunately here, the outcome is usually lower than what's expected. We don't hope to meet our outcome or our expectations, but usually the outcome is lower than what we had hoped. And usually it's compared with your smaller scale, lower magnitude impacts that, again, that outcome is not what we had hoped. So the Emergency Preparedness Program is a facilities comprehensive approach, and that's a big word, comprehensive, to meet the health, safety, and security needs of not only your patients, but your facility itself, the staff, and the community. And that has to occur prior to, during, and after that emergency or that disaster. And it has 4 core elements. These are the 4 core elements I mentioned in the objectives. You have to have a plan that's based on a risk assessment and brings into any and all types of hazards that are imaginable. Policies and procedures. You have to have a communication plan. And then the 4th element is training and testing. So as far as the emergency plan, the plan itself gives you the framework for your program, and it's developed from a facility and community-based risk assessment. So it's not just you. You also have to probably take into account your community and your population. And the idea is that it's to help you anticipate and address the needs, not only of your patients, but of course your staff and the community. How do you pull this all together so if it does happen, you're ready to respond? Also, to support your business ongoing, to keep that hospital in business, to continue to provide those services. You have to do an all hazards approach. Again, those of you in emergency management and environmental care, you know this phrase. That's an integrated approach to this preparedness program. And what you want to do is you want to focus on those identifiable hazards when you're developing your preparedness capabilities. So look at what's around you, what could occur. And those capabilities can address not only those, but also a wide spectrum of emergencies or disasters. So it doesn't have to be just 1 or 2 disasters you're preparing for. You really have to sometimes think outside the box on what could happen. What's the worst that could happen in our facility and maybe in a unit or in the community? And includes preparedness for those natural, Mother Nature, man-made, and then facility emergencies, those isolated strictly to you. It can include care-related emergencies, believe it or not. equipment and power failures, interruptions of your communications when you have a cyber attack. Any of you who have gone through those, they can be a nightmare because you're stuck. You have to go back to the old stone tablet, pen and paper sometimes just to operate. But nonetheless, that's a disaster. You could lose all or part of your facility. You could have interruptions of your essentials, your food, your water, your medications. That also could occur when you have an emergency or a disaster.